Assalamu alaikum. I am Dr. Mahbubur Rahman Polash, Assistant Professor, Department of Pharmacology at Bashundhara Ad-din Medical College. Welcome everyone in our today's session. Today we will discuss about anti-diabetic agent. Before starting anti-diabetic drug, we should know what is diabetes mellitus. Diabetes mellitus is a clinical syndrome characterized by hyperglycemia due to absolute or relative deficiency of insulin. Clinical feature of diabetes mellitus are polyuria, polydipsia, polyphagia, weight loss, nocturia and fatigue or tiredness. These are the common clinical feature of diabetes mellitus. Now come to the classification of diabetes mellitus. There are four major types of diabetes mellitus. They are type 1 diabetes mellitus, type 2 diabetes mellitus, other specific cause and gestational diabetes mellitus. Type 1 diabetes mellitus, it included may be immunomediated or idiopathic cause. Type 2 diabetes mellitus that occurs usually after age 30 years. There is a positive family history. Other specific types that causes genetic defects of beta cell function, genetic defect of insulin action, pancreatic disease like pancreatitis, pancreectomy, neoplastic disease and cystic fibrosis. Drug induced like glucocorticoid, thiazide, diuretics and phenytoin, these are the drugs that are also responsible for diabetes mellitus. Number 4, gestational diabetes mellitus. Gestational diabetes mellitus is defined as any degree of glucose intolerance with onset or fast recognition during pregnancy. Type 1 diabetes mellitus, previously termed as insulin dependent diabetes mellitus, is due to autoimmune beta cell destruction, usually leading to absolute insulin deficiency. In type 2 diabetes mellitus, previously termed non-insulin dependent diabetes mellitus, hyperglycemia is either due to impaired insulin secretion or impaired insulin action or in combination of both. Criteria for the diagnosis of diabetes. Diabetes is diagnosed based on symptom of diabetes plus plasma glucose criteria, either the fasting plasma glucose or the 2 hours plasma glucose value during a 75 gram oral glucose tolerance test or HbA1c criteria. Diabetes is confirmed by either fasting plasma glucose level greater than or equal to 7 millimole per liter or 2 hours plasma glucose value during OGTT greater than or equal to 11.1 millimole per liter or HbA1c greater than or equal to 6.5%. Management of diabetes mellitus. Number 1, dietary modification, discipline and drugs. These are the three main way for management of diabetes mellitus. Number 2, discipline, that includes regular physical exercise, weight reduction and cessation of smoking, and drugs include oral antidiabetic drugs, parenteral antidiabetic drugs like insulin. Now come to the oral antidiabetic drug. Oral antidiabetic drugs include number 1, drugs that enhance insulin secretion or insulin secretagogues like sulfonylurea group. In sulfonylurea group, it can be divided in 2 generations, first generation and second generation. First generation sulfonylurea, it includes tolbutamide and chlorpropamide, and second generation sulfonylureas, it includes glibenclamide, glipizide, glimepiride and glyclazide. Meglitinides include ripaglinide and natiglinide. Dipeptidyl peptidase 4 DPP4 inhibitor, it includes bedagliptin, sitagliptin, linagliptin, saxagliptin. Drugs that overcome insulin resistance or insulin sensitizers, it include number 1, biguanides. Biguanides contain metformin and fenformin. Number 2, thiazolidine diazones include rosiglitazone and pioglitazone, and other drugs that are alpha glucosidase inhibitor including acarbose and miglitolol. Sodium glucose co-transporter 2 inhibitors include empagliflozin, dapagliflozin and canagliflozin. Sulfonylurea mechanism of action. Sulfonylureas blocks the ATP sensitive potassium channel in pancreatic beta cell. That is why decreased potassium in efflux, depolarization of the beta cell, influx of calcium through voltage gated calcium channels and increased insulin release. Sulfonylureas increase insulin receptor synthesis, ultimately increase peripheral insulin sensitivity and reduction of serum glucagon level. These are the way of mechanism of sulfonylurea. Indications: type 2 diabetes mellitus in non-obese patient in combination with insulin in some type 1 and type 2 diabetes mellitus. Now come to the adverse effect. Hypoglycemia is the most common adverse effect of sulfonylurea. Also weight gain, GIT upset, allergic response in patient with sulfonamide allergies and teratogenicity. Contraindication: significant hepatic and renal insufficiency, pregnancy and lactation. Metformin. Metformin mechanism of action. Metformin reduces blood glucose level by different mechanism, reduces hepatic and renal gluconeogenesis, increased tissue sensitivity to insulin, decrease glucose absorption from GIT and decrease plasma glucagon level. Now come to the indications of metformin in type 2 diabetes mellitus patient as monotherapy or in combination. Number 2, insulin resistance syndrome, type 2 diabetes patient, but type 2 diabetic in obese person, treatment of polycystic ovarian disease and non-alcoholic fatty liver disease. Side effects of metformin are frequent but generally not serious. Gastrointestinal side effects are diarrhea, cramps, nausea, vomiting and increased flatulence. The most serious potential side effect of metformin use is lactic acidosis, but this complication is very rare. Metformin also interfere with the absorptions of vitamin B12. Contraindication: patient with hepatic and renal insufficiency and chronic cardiopulmonary dysfunction which causes tissue anoxia and increased risk of lactic acidosis. This is all about today. Thank you all for patient hearing. Allah Hafiz.